is Veronica de Jesus, and my specific purpose for today is to persuade my audience using argumentative techniques to support universal healthcare in the United States. Healthcare is a staple in all of our lives. We all need to seek it at some point or another. However, because of the many hurdles most of us have to face in order to obtain it, a great number of us forgo having proper medical treatment, only contributing to a nation plagued with growing medical comorbidities. We should push for universal healthcare in the United States. Because healthcare has become increasingly unaffordable for individuals and businesses, medical professionals could concentrate more on treating their patients, and free medical services would encourage patients to practice preventative measures. We first need to address how the costs of individualized healthcare are becoming overwhelming for our nation. At face value, the sheer cost of obtaining and keeping health insurance is proving to be too much for individuals and companies. Companies that provide health insurance to their employees are only allotted a certain budget to meet all the needs of their employees. With that budget, they have to streamline whenever possible. So when forced to put more money into insurance policies that are growing ever more expensive, there's less money budgeted for raises, orientations for new employees, PTO time, vacations, and so forth. The weekly describes that without the constraints of a healthcare mandate, companies would be free to increase salaries and hire more employees. When individuals pay out of pocket for these increasing healthcare costs, they also end up with less money. However, it may be less money for life's essentials like food, clothing, shelter, etc. In other words, less money that they are able to spend and less money that's being pumped back into the economy. When we take these points into consideration, we see that our country is unable to make a significant financial recovery, and we appreciate the idea that a simpler government-run system that reduces costs and would in fact go a long way in helping that recovery, based on statements from balancepolitics.org. We have to make steps in our national system if we ever seek to have the flourishing economy we once did, to have smoothly operating companies, and to have fulfilled, satisfied employees. Next, we will assess the benefit of allowing medical professionals to spend more time focusing on their patients and not insurance payments. The first question one gets asked when inquiring about seeing a new healthcare provider is generally concerning the type of insurance that they have. How debilitating that our healthcare provider is restricted by the type of insurance we have. Oftentimes, our doctor's level of practice is subject to the discretion of these insurance companies. For example, the doctors may forego ordering a specific test or procedure for a patient if they are not covered, but if that particular procedure or test is not covered by this individual's insurance. Doctors must practice defensive medicine in order to avoid being sued, both by insurance companies and by frightened patients who just can't meet the needs that meet the costs of whatever tests, etc., are ordered for them. So it ends up being a very messy system. A simplified universal healthcare system could remove the politics of insurance and thus leave healthcare providers to focus their attention and efforts on the care and status of their patients. Dr. Ronald T. Ackerman, Associate Director of the Center for Health Policy and Professionalism Research at Indiana University's School of Medicine, states, across the board, more physicians feel that our fragmented and for-profit insurance system is obstructing good patient care, and a majority now feel that national insurance support national insurance as the remedy. Doctors feel that they are under the gun and at the mercy of the insurance companies to streamline their care into cute, neat, precise packages. However, physicians take an oath upon graduation of medical school that they are going to heal their patients regardless of circumstances. How are they ever able to achieve this feat if their realm of care becomes restricted and ultimately due to money? Lastly, we'll examine how we can prompt patients to practice healthy, preventative measures. Patients would be much more inclined to inquire about their problems in health early on if they didn't have to worry about climbing costs or of being denied treatment. Many patients will avoid physicals and other preventative measures because of costs that they simply cannot meet. Americans often decline doctor visits that are routine or preventative in nature. With universal health care, the ease of mind for individuals of having health care covered would be insurmountable. Physicals, screenings, checkups would all be much more commonplace for Americans and ultimately lead to improved health and medical maintenance nationwide. This improvement would not only benefit the individual's health, but inevitably the nationwide cost of the system. The cost expenditure of preventative medicine is far less than the cost of treating a disease or condition once it has set in. Based on a 2008 peer-reviewed study in the Annals of Internal Medicine, there were 11.4 million uninsured working-age Americans with chronic conditions such as heart disease and diabetes, and their lack of insurance was associated with less access to care, early disability, and even death. Just think of how far preventative medicine could have gone for these 11.4 million individuals, and how far free treatment and medication could go to improve their situations, and how much better they could fare in all aspects of their life, thus leading to a much more productive nation overall. Preventative measures are the pillars of healthcare and necessary to control exacerbation of disease processes. In conclusion, as Greg O'Leary of the Weaklings points out, the Constitution itself states, "We, the people of the United States, provide for the common defense, promote the general welfare." Since the birth of our country, basic civil rights, such as adequate health care, have been expected, but not necessarily delivered. As Americans, I believe that we should strive for universal health care, because medical treatment has become progressively more unaffordable for individuals and companies alike. Medical professionals would be able to concentrate on healing their patients rather than the politics of insurance companies, and free medical services would prompt patients to engage more and become active members of their healthcare history. America is becoming an increasingly unhealthy country, with the CDC reporting that the top 3 killers in the United States are heart disease, cancer, and respiratory problems. How is the average person going to cover the cost of these treatments, medications, and so forth if they are unable to even put food on their table? They have to make a choice. Am I going to eat, or am I going to pay for my medication? Am I going to put gas in my car, or am I going to go to this doctor's visit? When you put it in terms like that, it becomes much more human. America pretty much stands alone as one of the only developed nations in the world that still does not have universal health care, and we must put forth the question, why? It's time to push for a change and reform within our country's healthcare system, because if one doesn't have their health, what is there worth living for? And in order to just further drive this point home, I have a small schematic from healthcarenow.org, which, though humorous, makes a good point. If we cut out our big insurance policies, our healthcare system will run much more smoothly. In addition, a chart from the Huffington Post which shows that in the past 40 years, our percentage spent on healthcare has increased 818%. However, our wages have increased 16%. And the discrepancy between the two, as you can visually see, is tremendous. And we all as Americans feel it every day, every time we have to go to the doctor, get a medication, what have you. and we see how exponentially the prices have gone up for these treatments, but our salaries have not, which is why we need to push for change and push for change as soon as possible. Make changes in your system and support universal health care. Thank you.